Hi and welcome to this video provided for you by the NHS Fife Rheumatology Service. This is the first in a series of 4 videos designed to introduce you to the service and to the concepts of self-management. We hope that you find this and the rest of the videos in this series useful. Our mission is to provide a high quality and patient-centred care system for people living with a rheumatic condition in Fife. The Fife Rheumatic Diseases Unit was set up in 1994 as a multidisciplinary, community-focused rheumatology service. Multidisciplinary means that we're a group of professional practitioners with different skill sets, all trained to specialise in a certain area. But in this case, we specialise in the investigation, diagnosis and ongoing support of people with rheumatic conditions in Fife. By working in a holistic and patient-centred way, we can help to prepare you to better manage your condition. In the past, we've often focused our efforts on controlling the physical pain, which on its own can be challenging. But like many other conditions, it's not only your physical health that's impacted by a rheumatic condition. This is because actually, biological, social, and psychological factors all play a role in your overall health, and are also affected by your condition. It's therefore necessary to address your physical, psychological and social well-being in order to better manage your condition. For the team, what matters to you is most important to us. Our team are here to ensure that you see the right person at the right time so that you have what you need to better self-manage. We're trained to deal with many different presenting challenges that you face, and this means that many of our staff can support you in many different areas of your health. By working together, we form a more diverse team, putting you at the centre of your care. Our service is based on an individualised approach, with our main interest being what matters to our patients. What matters to you might be very different from what matters to someone else, which means that every patient's experience will be different. Your experience with the team will be focused on what matters to you and what you need. Our team are trained to offer support with a wide range of your inquiries. Some things that you may want to discuss or ask us about at appointments are understanding your health condition better, or maybe medication or joint injections. You may want to ask about managing the physical aspects of your condition, or you might want to find out about feeling more confident and more in control. You may want to discuss how you're feeling about your diagnosis, or if you feel isolated. And we can also discuss with you options for further support or signposting. To give you an idea of how this might look, you're going to hear now from a patient that's chosen to send us feedback and share her experience with others.
Hi, I'm Kate. I live in Fife with my partner and have 2 beautiful children who are 2 and 5. I work part-time in my local supermarket and go to dance class once a week, which I love. I started having problems with painful swollen joints in my hands and feet and felt exhausted all the time. This really affected things at home and I ended up off sick from work. I got very anxious and down and I began to feel I just wasn't coping. After seeing my GP, she referred me to a rheumatologist and I was diagnosed with rheumatoid arthritis. What mattered most to me was getting my symptoms under control and getting back to the things I love doing. I realised I was going to need help from others around me. I also was keen to meet others who had arthritis too and hear about their experiences. I got plenty of support from the specialist team. I learned how to manage my new medications and started doing the mobility exercises I was taught. I was referred to a self-management program where I met others who were in the same boat, which I really appreciated. I was given advice about speaking to my manager and adapting my workplace and hours to suit my needs. I got given advice about footwear and got specialist insoles, which really helped my return to work and for my dance classes. After speaking with my self-management group, I felt able to open up a bit more to my partner about how I was feeling and asked him for more help in the mornings getting the kids up and ready. The group also suggested I have a word with my dance teacher about my worries going back to class. A year on, and I feel a bit more in control. Thankfully, my medications worked. Pain and movement have improved, and I used the rheumatology helpline for a few queries along the way. I still get pain some days, but I can manage it, and it's not the focus of my life. I enjoy being a mum again and doing fun things with my family. My partner is helping more in the morning, which has made a real difference. I got back to my work on different hours. My wrist supports make heavier lifting manageable. I love being back with my friends at the dance class, and the dance teacher introduced slightly longer breaks after each sequence to accommodate my needs, but everyone else enjoys too. I feel more supported and fulfilled again, and ultimately much more positive about the future.
Appointments are your opportunity to let us know how you're doing, to ask any questions or tell us what you need from the service. Before your appointment, it can be helpful to consider whether you're able to attend your appointment at the scheduled time, or if you need to change the date. Is there anything that you wish to discuss particularly during your appointment? And if so, writing things down before to bring to your appointment can help. What do you need to make your appointment? For example, do you need to factor in time for travel, or a stable internet connection, and so on. If you're not able to attend, please contact the team in advance. If you don't attend a scheduled appointment but still wish to be seen, it's really important that you make contact with our service. To make it easier for you to find the right support, we have a dedicated nurse advice line that you can contact if you wish to speak with someone. You may want to contact the advice line if you'd like to speak with a specific member of the team, or if you're experiencing a flare-up and your self-help strategies are not improving the symptoms. You may want to contact us if you have side effects that you think might be caused by medication for your rheumatic condition, or if you experience a reaction to an injection given by the rheumatology clinic. However, this is very uncommon. The advice line is manned, so you will speak to someone right away. However, they'll be there to take your details and then arrange a call back within 48 hours with one of our specialist nurses. Please remember though, that if you need urgent attention, then contact NHS 24 on 111 or call 999 in an emergency. By this point, we hope that you have a better idea now of how we as a team can support you in managing your condition. In the next video, we'll introduce you to self-management and talk a bit about how it can help with rheumatic conditions. Thanks again for watching.